As far as technology goes, I know you've got some technology here. You use lasers. You use a galvanic test.
Yeah, we do.
Talk to me about lasers in dentistry. I know you use lasers to treat gum disease, for
Yeah.
example.
Lasers are really good at treating gums or gum disease. They work. They call it biostimulation. It's a fancy word for the gums like the treatment, the energy that's used, because it's light energy, and the tissue has a really easy time absorbing that energy. It actually heals better from it. It's almost like a stimulation for your gums. Whether you use like a laser when you do a cleaning, you can do that, or you can do a little more treatment as far as pocket elimination, where the gap or the sulcus between the trough between the gum and the tooth. If that starts getting deeper and deeper, there's more of a space there between the gum and the tooth, then more bacteria can live in that space. And that's what causes your gums to get inflamed and red and start bleeding. It's that pocketing. And that's not a good thing over time, because you start losing bone also from that, because it just slowly gets worse and deteriorates, and you start getting what they call gum disease or periodontal disease, which can lead to bigger problems.
Right.
Lose teeth.
Right.
You can lose your teeth.
Right.
So
It has effect on the whole immune system as a whole, right?
yeah, there's more research coming out where gum disease can cause more of a stress systemically over time.
Right.
What you're doing basically is leaking bacteria into your bloodstream from your mouth, from your gums. And that can it's just a slow stressor, immune-wise, and it shows up, and there's research now showing this, where heart disease, different things, strokes, arthritis,
Right.
are the big three. Pancreatic problems can be linked back to the mouth, to gum disease. It's pretty fascinating, pretty scary if you think about it.
What are the treatments like? What are the laser treatments like?
You need to do the basics still, of course. You need to do the cleanings or deep cleanings, whatever you
Right.
need. You need to do the home care that has to be put in place properly. You need to be educated how to do that. A lot of patients don't know quite how to maintain your teeth correctly
Right.
with cleaning. It's just day-to-day routine. And then the laser can come in and really amplify what you're doing and support, and because you can go within the sulcus and treat the gums. It can remove bad tissue from the pockets. Of course, it can kill the bacteria and stimulate the gums to heal right after that, heal faster. So normally you get a little improvement with cleanings, or maybe a little more improvement with deep cleanings, but this is like the third piece of it, or the second piece of it, to really get those gums back where they need to be, tight, healthy, and pink. So.
And you've seen a difference in the amount of time it takes adding in the laser versus the maybe more traditional or conventional ways of treating gum disease?
Yeah, it's significant. It's pretty dramatic, the difference of what can be accomplished with it, and how the gums heal, and where they end up. In terms of the pocketing and the general, even the look of the gums is different. They look healthier. They look tight, they're pink again. It's like getting for instance, when I do a crown or cap on a tooth, I use a laser with it to work that treatment into the overall result. So the gums, it's like getting a new tooth. The gums fit the tooth again. The gums fit the crown again.
Uh-huh.
So they don't compete with each other. A lot of crowns have that little bit of a line around them, like
Right.
a darker red line in the gums.
Right.
That can be really kind of basically eliminated. And because we can eliminate pocketing when we do a crown. And that's an added benefit, during that treatment.
Is it expensive
For the patient to
for
do
the
the laser
patient to
treatment?
do the laser treatment?
Well, what we do is it can be expensive depending on what kind of laser you have, how the office is geared up, and how they do this. But what we do is we include the laser treatment when we do a crown, for instance,
Oh,
in
really?
the crown fee. Yeah. And when we do a cap, because we believe in it, the results are worth it. For the gum care, the general gum care, we basically, it does, if we're treating the entire mouth, for instance, at one visit, the fee is like, it's less than $200 to include the laser. If it's more involved, you have to do a little more per area, then you can basically apply that fee to the area. It depends on the severity of what you're doing, what you're dealing with.
Mm.
So, but the short answer is, it's not that bad. It's
Right.
pretty reasonable
Right.
for the results. I mean, if you compare doing nothing, it's not always a good idea.
Right.
Doing this or doing, for instance, going to a specialist to treat your gums, because specialists, the work they do is pretty involved, and they actually do the full-on, they basically cut the gums away from the teeth and then replace them
Mm.
in a little different position to eliminate the pockets.
Mhm.
That's good treatment. It works, but it's also very expensive.
Right.
It's
More
also
invasive.
It's
Right.
pretty, yeah. It's
Pretty
a
invasive.
it's very it's traumatic.